Right, going back to that story of the Nhawu strikes, reports are emerging that maintenance workers at Gauteng hospitals are being barred from entering facilities. And this is because the public sector strike by Nhawu affiliated members continues. This means that should equipment fail, patients' lives could be at risk. Among the hospitals affected are Charlotte Maxeke, Helen Joseph, Leratong, Sebokeng, Kopanong and Carltonville, among others. For more, I'm joined by Masabata Motlaneng, who is the Provincial Infrastructure Development HOD. HOD, thank you so much for your time this evening here on eNCA. So, on the news for the last couple of days, we've been talking about dangers to patients during the strike action, patients who can't access hospitals, patients in hospitals who are jeopardized in terms of limited access to treatment, limited access to food, to medicines, to clean linens, to adequate sanitation services. But there are also dangers to patients if critical equipment fails and that it cannot be maintained because workers doing that maintenance aren't permitted access to these facilities. What kinds of equipment could we be talking about?
Good evening, Andy, and good evening to the listeners as well. I think that's quite correct. Most of the medical equipments that have been affected includes boilers. You know that every hospital depends on boilers for provisioning of steam. This also includes the generators in instances where there's issues of load shedding or power to a hospital. This also thirdly includes autoclaves. Autoclaves are utilized to sterilize any medical equipment, especially during operations or whenever there is an emergency. Fourthly as well, we've also learned because we've done an assessment for today, just in terms of the update of what is currently happening. There's also lifts that have been affected, kitchen equipment also that have been affected. As you know that every single day patients have to continue to eat, and therefore if there's no proper kitchenware for them to be able to do that, it then impacts on that. So it is really a bit of a dire situation, Andy, and indeed our suppliers are not also able to access the hospitals, not just only the staff, but also our staff, our service providers. We've also learned, for an example, in Betha, that one of the service providers needed to go and deliver the generators, battery generators, and they were not allowed. So as we speak, every hour that goes by where there's the strike, indeed, it is impacting negatively on the ability for the hospital to provide basic health services and health wellness to our communities.
So we know that the power cuts at the moment exacerbate the situation. Equipment needs more frequent maintenance during these power cuts because, they're simply overloaded. Can you tell us about incidents that have been recorded in Gauteng where perhaps, has it happened yet that essential equipment has failed and workers have been denied access, and what's been the result?
Well, there's various hospitals. We're sitting with about 15 hospitals that currently have been affected. I think we've mentioned a few in your opening. As I said, it really varies from one thing after the other, to the extent that it definitely has an impact in terms of the health workers being able to give services to the patient. But I think all in all, for an example, and this ranges from different areas. In Sebokeng and Kopanong Hospital, for an example, it's both in terms of boilers as well as autoclaves in this instance. What it means is that then patients are there effectively, and doctors and nurses, they're not able to provide and to provision their services. So as things stand now, we are really in a dire situation.
What is the contingency plan should there be such a failure of critical equipment that needs urgent maintenance? Do you have some other way of getting workers and maintenance crews to the hospital? Would they perhaps be escorted by the police or security services? What plans have you put in place?
So at the moment, the hospital management is working closely with our department staff to ensure that they do give some provision to that. As an example that I made earlier on of Betha, or for an example, we have been informed by our team on the ground that the hospital has allowed access to that specific service provider through the assistance certainly of the SAPS, who has managed to export them. But to the extent that if anything else happened beyond that, it means therefore that the hospital nurses and the staff are really not in a position to can assist. So, but at the moment, we've been able to be able to unlock some assistance, but not really to the extent that which the hospital should be in a position to can run efficiently and effectively without those staff. Remember also, some of the staff, in solidarity of those that are in strike, they are also on a go slow. So some instances you know that they are there, they are present, but some of them are being threatened not to be physically attending to some of these. But at the moment, I think we are really doing anything possible to make sure that our own staff are in attendance. We have made sure that the artisans and the chief engineers in most of the hospitals are available 24/7 to ensure that they do assist the nursing and the hospital medical staff in those specific hospitals.
Before I let you go, what is your appeal to striking workers who are preventing access to the facilities for the crews that you need to send out?
Our view as provincial government, I think we understand the challenges that they are faced with and why indeed they would go to the strike or to go on strike. But I think the one thing that we are saying is that medical professionals must not forget that they've taken an oath of being able to provision health services based on their profession. And we are saying, whilst there are issues that they are raising that are very important, that are critical, but they must not impact negatively on the lives of those that indeed they are supposed to be serving. And we are saying engagements are taking place. Whilst those engagements are taking place, they can at least protest. There can be a slow way of protesting, but not to the extent that you even allow or don't even allow access to the hospital. So we are pleading with each and every one of the employees of the hospitals to say that they are essential services. They are not supposed to be on strike, and they do know that they are not supposed to be on strike. Their organized labor, or how in this instance of the HANDIMOSA, are supposed to simply continue to be on the table to raise the issues with the relevant authorities in provincial and national government, but they should go back to work because society is indeed dependent on each and every one of them. So we are really pleading with them to go back to hospitals.
Thank you so much for speaking to us this evening. That was Gauteng Infrastructure Development HOD Masabata Motlaneng giving us an update on the impact of the Nahawu strike on equipment at hospitals, which once again could threaten the lives of patients.